The operating room lights began to flicker when everyone at Sacred Heart Medical Center fell into panic. Nurse Maria Rodriguez was assisting Dr. Chen in a heart surgery. As the storm intensified, the hospital's electrical system collapsed. The generators failed. Maria lifted her head from the operating table. "Keep going," she told the surgeons. "There's a patient dying in here." Dr. Chen looked worried. "Maria, we can't perform surgery in the dark. This is too dangerous." But Maria was already reaching for the surgical instruments because those dark operating rooms weren't foreign to her. And in the next 45 minutes, everyone in the operating room would learn who Maria Rodriguez really was. Because some people wear nurse uniforms but never remain passive. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Maria Rodriguez was the perfect operating room nurse. At 34, she had been working at Sacred Heart Medical Center for 6 years. She would arrive at work at 7 a.m., leave at 7 p.m., never missed a patient report, was never late, never complained. Everyone on the surgical team loved Maria. She was calm, reliable, someone who could always find something that couldn't be found. Doctors found confidence in her composure. Patients found peace in her gentle touch. Maria's partners were operating room technician David Martinez and assistant nurse Jennifer Kim. David was 28, an experienced technician who had been working in operating rooms for 5 years. Jennifer was 31, a talented nurse who had been working at Sacred Heart for 7 years. But Maria was different. Maria's equipment checks were different from others. She would inspect every tool with surgical precision, surgical instruments, anesthesia equipment, heart monitors, as if she were preparing a battlefield operating room. Her colleagues sometimes found Maria's methods strange. "We're nurses, Maria, not surgeons," they would say. Maria would smile and not answer because actually both were wrong. The depth of Maria's medical knowledge amazed even surgeons. "Which medical school did you attend?" they would ask. "Different places," Maria would say, always vague, never giving details. And those places were very different from normal medical schools. Maria Rodriguez had joined the army at 19. But why? Maria had lost her mother to a sudden heart attack at a young age. Her 43-year-old mother had suffered a heart attack at home and couldn't be transported to the hospital in time. Maria was only 16 years old. That day she made herself a promise. "I will get the best medical training. No one will be lost due to sudden situations like my mother." When she joined the army, she chose Medical Corps. After basic medical training, she was selected for special training. Army Special Forces Medical Training, the most challenging program. But this was just the beginning. The real specialized training was yet to come. Special Operations Medical Sergeant Course, an 18-month intensive training program, surgery and field conditions, operations with limited resources, surgical intervention in darkness. Maria was selected for the top 5%. And this training would be very useful in the operating room that night. "A Special Forces medic isn't just a soldier," said Training Commander Captain Williams. "You're the person making life and death surgical decisions. Even without electricity, even without full equipment, you will save the patient." Maria embraced this philosophy, producing surgical solutions without resources, performing surgical intervention in darkness, showing surgical leadership in critical moments, and struggling surgically against technical obstacles became her fundamental principles. The most difficult part of her training was surgical operations with minimal light. Performing surgery under flashlight, executing complex procedures with basic tools and developing improvised surgical techniques. Maria had developed superior abilities in this area. Her first assignment was with a forward surgical team in Afghanistan, a forward-deployed surgical team operating on wounded soldiers before they could even be transported to an operating room. Advanced medical procedures under war conditions. Maria's most difficult intervention was saving a helicopter crew member injured in a bomb attack. In a tent operating room in darkness due to generator failure, she had performed open heart surgery under flashlight. Her second assignment was in Iraq. This time attached to Special Forces, medical support on the most dangerous missions. gunshot wounds, explosive injuries, complex cardiac traumas, and the techniques she learned on these missions were things never used in civilian hospitals, especially manual surgical techniques during power outages. Maria had taught herself to work in darkness, minimal light, limited resources, maximum precision. Her hands had become precision instruments, and those hands would save lives in the operating room that night. Her third assignment was near the Syrian border, Black Operations Medical Support, combat surgery under fire. Maria had now achieved field surgeon-level competence. But most importantly, she had never allowed any technical obstacle to stop surgical intervention. Over 10 years, Maria had saved 142 critical surgical cases, never losing any due to technical obstacles. So why had she left the army to become a nurse? This story was more complex. PTSD, adjustment issues, civilian life challenges. Maria's transition hadn't been easy. High-stress medical work felt comfortable, but civilian hierarchy was different. And this frustration would explode that night. After receiving an honorable discharge in 2018, Maria had transitioned to civilian medicine. She had used PTSD therapy, adjustment counseling, and career transition support. Operating room nursing had been a perfect fit. It reminded her why she became a medic, helping vulnerable people. The operating room environment was a predictable routine after years of chaos. Peace was welcome. When Sacred Heart Medical Center hired her, Maria was overqualified. Nursing degree, 10 years of military medical experience, Special Forces medical certification. But the hiring committee didn't ask detailed questions. They were happy to find a qualified candidate. "I've always loved working in operating rooms," Maria had said. And this time, she was genuinely sincere. Daily work was simple compared to combat medicine. Surgical preparation, doctor assistance, patient care. But Maria was doing much more. She evaluated every case with Special Forces medic eyes. She detected signs of surgical complications early. She identified potential emergency surgical situations in advance. "Maria, how do you know surgical procedures so well?" her colleague Jennifer would say. "Observation," Maria would say. "Every surgical intervention is educational." This observation came from 10 years of field surgery training. Thursday evening, March 25th, a busy night shift had begun at Sacred Heart Medical Center. A severe storm was affecting the city. Wind was rapidly increasing. Lightning was flashing. Severe weather conditions were shaking the hospital building. Maria was on duty in the main operating room. The evening shift was about to end. At 9:30 p.m., a critical heart surgery case was brought in. The most urgent case was 62-year-old Antonio Vasquez. Acute myocardial infarction, emergency bypass surgery required. Dr. Chen would lead the operation as chief surgeon. "Maria," said Dr. Chen while checking surgical preparations, "this is a complex case. Let's make sure everything is ready." "Yes, doctor," said Maria, systematically checking surgical instruments. But Maria had noticed an unusual detail. While checking operating equipment, she could sense fluctuations in the electrical system. Lights were slightly flickering. The storm outside was intensifying. At 10:15 p.m., surgery began. Antonio Vasquez was under anesthesia. Chest area opened. Heart bypass operation was continuing. "Heart functions normal," reported anesthesiologist Dr. Patel. "Good," said Dr. Chen. "I'm placing the bypass grafts." Just then, a severe lightning struck outside. A powerful sound that would shake the hospital building. And then everything went dark. Operating room lights went out. Heart monitors stopped. The ventilators ceased functioning. The hospital was suddenly plunged into darkness. "The power's out," screamed Jennifer. "Where are the generators?" Dr. Chen asked in panic. A few seconds later, an emergency announcement came. "All personnel attention, power outage, generators malfunctioning, repair team called. All non-emergency operations will be stopped." "We can't stop this operation," said Dr. Chen. "Antonio's heart is open. If we stop, he'll die." But we can't perform surgery in darkness, said Dr. Patel. Only the dim light of emergency exit lamps was in the operating room. Antonio Vasquez's life was in danger and surgical intervention couldn't wait. Maria moved. 10 years of Special Forces training kicked in. Are there any flashlights? Maria asked. Yes, but they're not sufficient for surgery, said Jennifer. Get them, said Maria. And turn on your phone flashlights. Maria, said Dr. Chen. We can't perform heart surgery in darkness. This is impossible. Maria looked at the operating table. 62-year-old Antonio Vasquez was fighting for his life, just like her mother years ago. He would die due to technical obstacles. Have you performed surgery under these conditions? Dr. Chen asked. Maria's answer would shock everyone. Under much worse conditions. Flashlights were brought. Technician David turned on his phone's flashlight. Jennifer was holding surgical instruments in the flashlight's beam, but the light was insufficient. Shadows were dancing. Every movement was difficult. Maria moved to the head of the operating table. She assessed Antonio's condition. Dr. Chen's half-finished bypass operation had to be completed, but conditions were disastrous. Dr. Chen, said Maria with an authority in her voice they had never heard. I can continue. Maria, you're a nurse. This is heart surgery and in darkness. I was a Special Forces medic in Afghanistan. In a tent, I performed open heart surgery under flashlight. Complete silence. Only the sound of Antonio's weakening heartbeat monitor could be heard. Maria changed her sterile gloves and moved to where the operating lamp was. In the flickering light of flashlights, 10 years of military surgical training automatically kicked in. Dr. Patel, continue anesthesia monitoring. Don't leave your post. Maria's voice was in command tone. Jennifer, hold the surgical instrument steady. No shaking. David, continuously report vital signs. Heart rhythm dropping. David shouted. Don't panic. Stay calm, said Maria, her hands already working. In darkness, only by touch, she was locating the bypass grafts. Dr. Chen was watching as if frozen. Maria, this is impossible. You can't even see. I don't need to see, said Maria, her hands working with perfect precision. I can feel. The operating room fell into tense silence. Only Maria's calm breathing and the metallic sounds of surgical instruments could be heard. First graft being placed, said Maria. The flashlight was flickering, but her hands weren't slipping. Pulse continues to drop, said David in panic. Stay calm, said Maria. Second graft being prepared. The storm outside was intensifying. Wind was hitting the windows. The operating room was shaking. But Maria's hands continued working with unimaginable determination. Maria, said Dr. Chen, the heart is starting to stop. It won't stop, said Maria with determination. She began placing the third graft. In darkness, only by touch, she was connecting life-giving vessels. Jennifer couldn't hold the flashlight. Her hand trembled. The light disappeared. Jennifer, Maria called out. I'm sorry. Jennifer redirected the flashlight to Antonio's chest. Maria paused, then continued. Final graft being placed. Vital signs at critical levels, reported David. Maria made the final suture. Completed. Check heart functions. A few seconds passed. Silence. Then heart rhythm returning to normal, said David in amazement. Blood pressure rising, added Dr. Patel. Maria breathed for the first time during that night's surgery. Bypass surgery completed, she said calmly. Dr. Chen was staring with his mouth open. This was impossible. 45 minutes later, the power came back. Operating room lights came on again. All devices started working, but the surgery was almost completed. Maria was making the final sutures. Antonio's heart operation had been successfully completed. Dr. Chen looked at Maria. This was an incredible surgical performance. Maria removed her gloves. It was just necessary. "No, Maria," said Dr. Patel. This was a normal nurse performance. "You're a surgeon." Maria hesitated. It was time to break 6 years of secrecy. "Dr. Chen, can I tell you about my real background?" After the operation, Dr. Chen wanted to talk with Maria. "Maria, what you did tonight was extraordinary, but I need to learn your identity." Maria remained silent for a long time. Then she began to speak. "I served 10 years in the United States Army. I was a Special Forces medical sergeant, 3 tours of duty, Afghanistan, Iraq, classified operations." Dr. Chen couldn't believe it. "You're a military surgeon. Special Forces medic. Advanced surgical procedures under field conditions. Surgery in darkness. Life-saving operations with minimal resources. Why did you never mention it?" "Because it wasn't necessary. I'm a nurse now." "Where did you learn these surgical skills?" 18-month Special Operations Medical Sergeant course. Field surgery, dark surgery, emergency leadership, surgical resource management, but most importantly, never allowing any technical obstacle to stop surgical intervention. When Antonio's family learned about Maria's story, they came to the hospital. "Nurse Maria," said Antonio's wife, Carmen Vasquez. "I don't know how to thank you for saving Antonio." "I just did my job," said Maria. "No," said Antonio's daughter. "The doctor said under normal circumstances the risk of losing Dad was very high. Your ability to perform surgery in darkness saved him." When Antonio woke up, he saw Maria. "Are you the nurse who saved me?" "Yes, Antonio." "How are you feeling?" "Very good." This nurse was a real hero. Maria smiled. "You're very strong, too, Antonio." A year later, Maria began working at Sacred Heart as a special operations medical consultant. She was still nursing but also giving dark surgery training. "Power outages aren't just technical obstacles," she would say in training sessions. "They require adaptation, improvisation, alternative surgical solutions. Most importantly, no technical obstacle should cause the loss of a patient's life." Maria's story isn't just a heroism story. It's also a story of surgical expertise against technical obstacles, finding meaning in civilian life and the instinct to serve. Because sometimes the greatest surgeons work as nurses in hospital corridors, saving lives even in darkness. When Antonio came for checkups, every time he saw Maria, he would say, "Real heroes overcome technical obstacles." The courage Maria showed that night at Sacred Heart didn't just come from surgical training. It came from her determination to protect people from technical obstacles in civilian life. "I'm no longer a soldier," Maria would say. "I'm a healer and no technical obstacle will cause me to lose a patient." So I ask you, have you ever received medical care from someone like Maria? Healthcare workers whose military background you didn't know? Where you only saw the ability to overcome technical obstacles? Share your experiences in the comments because here at Hidden Legends, we know that the greatest healers often serve in the most humble roles. If this story moved you, share it, subscribe, and to help these important stories continue. We'll see you in the next legend. And until then, remember, your healthcare worker might have the ability to overcome technical obstacles you'll never know about. Service never ends. It just overcomes darkness.